Hello to everyone. In this video, I am going to show you how to assemble the laryngoscope blade with the handle. Firstly, look at the handle, blade, the parts of this laryngoscope: handle, blade, tongue, spatula, curved hook, tip of the blade. And now I am going to show this is the blade having the bulb, and there is a handle which I am going to assemble. Just have a look. Firstly, hold the handle of the laryngoscope in the left hand and place the bar, showing this bar, in the medial side, and hold the blade in the right hand, and the convexity should be the outside, concavity in the inside, and then place the hook at the bar at the 45 degree, and then gently press and straighten the blade, and with the sound of click it is fixed in the laryngoscope handle. And after the fixing properly, the light will be start when the cells are given. In this, I am not having the cells, so light is not lighten up. And now it hold the laryngoscope in the left hand as shown in the video, because it provides the right hand free to intubate the patient with the endotracheal tube. And with this, we can visualize the trachea and can simply insert the endotracheal tube for the proper positioning of the tube and intubation. And the angle should be 45 degree during the assembling of blade to the handle. And after that, when the blade is fixed in the handle, then straighten to the 90 degree, and the sound of click is produced at that time. Just have once again look how I'm going to place this. Just simply at the around 45 degree angle, gentle press and a click, and the fix. Now there is a different size of blades according to age, which are used in different age groups. When the proper positioning is done, then the bulb is lighten up. Thank you for watching this video. Have a nice day.